Good afternoon, everybody, and welcome to this Care for Care policy series meeting on care as a driver for well-being. I'm David Rinaldi, one of the directors at FEPS. I'm responsible for policy and the quality of our studies, and that is why I'm particularly happy to discuss with you all today and to present some of the results and the inputs in one of our publications that is focusing on the European care strategy, a chance to ensure inclusive care for all. The meeting that we are hosting today is a collaboration between FEPS, the Foundation for European Progressive Studies, the Friedrich Ebert Stiftung, particularly the office in Brussels, and EPSU, the European Public Sector Union, that actually representing over 8 billion of workers active in the public sector and federating more than 260 trade union or organizations. Of course, care is a big business. Care is actually also a driver of equality. Care is a driver of social cohesion if we address it properly, of course. Indeed, we are also gathering today in early September 2023, exactly 1 year after the launch of the European care strategy. But the objective is not only somehow assessing what has been done in this European care strategy, the step forward that has been made, and maybe somehow the still remaining problems with the care deficit that are still somehow needs to be addressed. But at the same time, we want to continue the work that we have been carrying out with the Friedrich Ebert Stiftung on framing care as a prism for equality, sustainability, and prosperity, in order to transform this into one of the building blocks of a well-being strategy, even of an economic strategy. So we are very happy to present, to have with us distinguished speakers today. I will pass them the floor in a second. Let me mention them one after the other, so you all know who's with us today. We will start with Professor Chiara Saraceno. She's an honorary fellow at the Collegio Carlo Alberto in Turin, and I'm Italian as well. As Professor Saraceno, I'm extremely pleased of having today at FEPS, so one of the leading Italian sociologists in the field of social policy and equality. Professor Saraceno, is a pleasure to have you here. And as well, after the presentation of Professor Saraceno, we will have contribution from the policy analysts at the European Parliamentary Research Services. Cecilia Naverra, she is also accompanied by the colleague and co-author Menakeshi Maria Fernandez. They are also co-author of a chapter in the study that I just shown you on care as a driver for sustainable growth, and they're also working tirelessly at the European Parliament to showcase the European added value in different studies. So they are part of the European added value unit, and in this case they will showcase how care can be an added value, and particularly how a European action on care can be of value for all the European citizens. After their presentation, we will kick in with a comment and a political our assessment of where we stand and where we will go, with the member of the European Parliament, Milan Brglec, from Slovenia, that on top of being an expert on the topic, had also the responsibility to be the co-rapporteur on the Common European action on care. So he has been working politically and legislatively on this, and he is also planning on campaigning on this. So the objective is not only, as I was mentioning, assessing what has been done, the value of what has been done at the European Union level, but also where we want to go next. And next has two also big issues. One, how we can use a real care framework, a care prism, prioritization of these issues to deliver a type of idea of the Europe we want, ideally in view of the campaign, because this is also one of the topics that differentiate the political spectrum, but also what do we want for maybe the next Commission and the next legislation? What are the next steps that needs to be done for an action plan on care for 2024. So I stop here because I already spoke too long, and without further ado, I'm happy to give to Professor Saraceno the floor. She will be presenting one of the chapters of the policy study on the European care strategy. She worked primarily on the issue of the link between care and social cohesion. Professor Saraceno, you have the floor.
Thank you. Thank you for inviting me, and good afternoon, morning to everybody. Yes, my chapter was mainly on the demographic context and challenges of care issues, and looking from the perspective of childcare and long-term care for the frail, old, but also for the disabled, we can see that there are two somewhat opposite issues of demographic scarcity. Because in the case of children, the scarcity concerns children themselves. That is, that there are too few, according to demographic perspective, children. So it's not an issue that there are too many and we do not know, and there are not enough caring resources for them, but on one side, there are too few. And if there is a scarcity at all, it concerns the tensions which are put on mothers mostly, not generically on the family, but on mothers, because as long as we want to encourage women, and particularly mothers, to stay in the labor market for many, many different reasons concerning their freedom to begin with, then we cannot count only on family and particularly mother care. So the possible imbalance between those children needing care and available care concerns not the too many children, but to some degree the reduction or constraints on mother's time. But in the case of children, as I will say afterward, scarcity itself drives a different perspective on the value of providing through public means care and education. In the case of the old, instead, to some degree, there is the opposite view. That is, luckily, because we live longer and there is a demographic imbalance from the point of view of the age structure of population, but also of the kinship network. So there is an increasing imbalance between the numbers of those needing some kind of care because of old age, because of frailty and so on, and potential family carers on one hand, because there have been fewer children along the generations, and also more women are in the labor force, but also at the societal level, because the numbers of those needing care put a pressure on public budgets. in the two cases, the care issues are interlinked, because the lack of adequate and affordable care is one of the causes of reduced fertility, because it is difficult to combine engagement in paid work and engagement in childcare, full-time engagement in childcare. And in turn, it's just one of the causes, not the only cause. But this lack, which is different according in different countries, in turn reproduces and strengthens intergenerationally the demographic imbalance, because if women, particularly couples and women in particular, decide to have that they cannot afford to have more children, of course, they will reproduce over time the demographic imbalance, which already happened in the past and is happening now, and the scarcity of human and financial resources for long-term care. Investing, therefore, in early childcare and education, and I stress the education part, not only the caring part, and long-term care, is also means to help redress the demographic imbalance. Now I will focus mainly on long-term care. I will just notice that childcare actually is at the heart of many different issues: work-family conciliation, gender equality, but also investment in children, and so on. So it's a very complex issue, which has already been addressed in another of it here. While long-term care is really the exemplary item of the demographic imbalance, which is to some degree present in all our countries. Population aging affects in opposite ways the pool of potentially dependent persons and that of potential carers, both at the population and at the family level, because on one hand, there is an increasing population of people who will need for some kind of care for a longer or shorter period, but which is not only foreseeable. But on the other hand, because of population aging, which has to do not only with longer life expectancy, but also with lower fertility, there is a shrinking pool of potential carers, both at the population and family level. According to the most recent data within the EU as a whole, the share of the age cohorts above 65 years in the EU population is expected to rise very strongly from 20% to 30%, with the share of those aged 80 or over doubling from 6% to 13%. By contrast, the share of the age group 20 to 64, that is the working age population, would fall from 59% to 51% of the total population. And women in the 50s to 64 age bracket are the actual sandwich generation. That is, those who have often to deal with the needs for the younger generation and grandmothers, for instance, more so in countries where services are not adequately present, and for the older generation. But there are wide cross-country differences in the degree to which long-term care is familialized or defamilialized. So we cannot just have one snapshot equal for all. We should not forget also the impact of migration, but also the dual impact of migration, because it is true that migrant care workers, which are mostly female, although not only female, are certainly a resource, a caring resource for within the countries where they migrate to, but also they reduce the caring resources in the countries they come from. So they can, the impact of migration should be looked in both ways, not only between European countries and non-European countries as descending countries, but this, let's say, this opposite impact can happen also within EU itself, since many migrant care workers come from within the EU. They move from one EU country to another. Providing better, and I'm going toward the conclusion, providing more and better care, both for children, also in the form of education, not only care, and long-term care, is often debated as a cost. But we know that we try to argue that it's not only a cost, and actually it's not mainly a cost, because not only it contributes to the well-being of the population, but also the care as a work sector also can create additional job demands in a situation where often there is a scarcity of job demand. According to an ILO study, investing 1.1% of GDP in early child care, education, and an additional 1.8%, so altogether 3% in long-term care each year, would create an additional 26.7 million additional jobs by 2035, which is quite substantial. And this would enlarge the tax basis and have a dual impact on women's labor force participation, because on one side, it would free time to work for pay for working age women. On the other, women who are family carers. On the other hand, increasing job opportunity in this field that traditionally is largely female is really an opportunity for women who want to stay in the labor market. In order for this to be good news, however, it is necessary that these jobs are good quality and fairly compensated, which is not always and everywhere the rule now, but in the formal and in the informal labor market. In addition, one issue that should be addressed is, can government afford to wait for this long-term positive effect in the present situation of tight budget rules, tight budget rules which affect negatively, particularly the countries which have a scarcer care service endowment. So this is an issue, the tension between not only the care strategy, but the need to increase care provision, non-family care provision. On the other hand, how can countries deal with this, having tight budget rules and public debt, a high public debt? And in this perspective, I would like to say that the lack in the strategy of clear numerical targets and deadlines with regard to, not to childcare, but to long-term care is problematic. Because if there are no deadlines, no numerical targets to monitor, how can we monitor, how can we press from the EU level, but also at the country level, how we can press country to perform better in these issues. And just to finish, I want to mention two other problems which I find in the recommendation and in the document which accompanies it. So there is an under-evaluation concerning long-term care of the caring needs due to mental health, which are increasing, not only among the elderly, but also among the young. So dementia, Alzheimer, other kind of mental health. And also there is something which is really problematic for me, the confusion between family and informal care. Family care is not informal care. Informal care has to do with the informal labor market. Family care actually is often expected, it's far from being formal, it's not paid, and it's not professional, but it's not informal at all. So I think that this ambiguity should really be clarified, which also would put forward also the needs of family carers, the need for support, for time and so on for family carers. Thank you, and excuse me if I have been too long.
Definitely not too long, and for sure very interesting and to the point. I sum up three of the last points that you left somehow as important for the discussion, for the way forward for a European action on care. Let's make sure that we don't under-evaluate the needs, particularly connected to mental and health in general. Let's push seriously for target and timelines, otherwise it's difficult to get real an achievement, and that's also one of the shortcomings that you put in your chapter on the recommendation on long-term care. So we hope that maybe with the next commission we will be able to move in this direction, as well as the other important point that is conceptual of rejecting this notion of the informal care, because it is somehow formal, real, and sometimes also demanding and professional in a sense, just unpaid. Thanks a lot, Professor Saraceno. I'm passing the floor to Cecilia Navarra, but while I'm doing so, I would love to thank and welcome Mary Collins, that is the Senior Policy and Advocacy Coordinator on the European Women's Lobby. She has just joined us, and she will also be discussing the exchange in this talk. But Cecilia, you have the floor, and I would also like to invite all the people that are listening over, either on Zoom or on the YouTube channel of FAPS, that they can already start putting some of their questions either on the Zoom, in the chat, or in the Q&A session, or in the comments on the YouTube. We will with colleagues, we will gather questions wherever they appear. Cecilia Navarra, you have the floor. Thanks a lot.
Thanks so much to you for the invitation, and good afternoon now maybe to everyone, and we are very glad of having taken part to the REACH FAPS publication and to be here today. What I'm presenting, as David introduced before, is a joint work with my colleague Mina Fernandez, who is also here participating. So we'd say it's really a joint work what I'm presenting. We both work at the European Parliamentary Research Service in a unit called European Added Value Unit. That means that we conduct analysis on, so the core of our analysis is to analyze the case for action at the European Union level in different areas. And we started developing our analysis on the added value of EU action on care work to accompany to accompany the Parliament's report before and during the discussion of the care strategy. What our main finding really nicely build on what Professor Saraceno was presenting before is the core message of our short study is that there is a strong social and economic case for EU action on care work. Then this is for a number of reasons that in our analysis of the status quo, we always start from an analysis of the status quo, we connect in what we call a vicious cycle where gender inequalities in the household and in the labor market meet what we call a low investment model of care provision based too much on cost cutting and very often on poor working conditions. Well, the evidence of this vicious cycle has been highlighted by the overview just presented by Professor Saraceno. So the impact of unpaid care tasks on women participation in the labor market and on their employment conditions, the supply of care services, especially some care services that fall short of the needs, and the often too poor working conditions of professional carers. And I'm glad that we decided to not to use informal carers as a concept, but to use unpaid care to identify work that is done within the care work that is done within the household, and undeclared work to indicate the high share of professional carers who work in an undeclared context, so without contracts, without recognized rights, and so on. So we substantiate the vicious cycle with EU-level gender-specific data from Eurostat, and we do a simple data modeling exercise. And in this data modeling, we consider alternative scenarios. So for example, we asked ourselves, what if women participation in the labor market were like that of men's due to unpaid care work? In other words, what if care tasks within households impacted women as they impact men in terms, for example, of activity rate and the incidence of part-time? And well, we find that labor market earnings could be up to 242 billion euros per year. And this is what we call the care penalty of lost labor market earnings because of an imbalance between men and women in unpaid care in households. So the care strategy proposed by the Commission relies on an overall accurate analysis of the problems, but has a number of problematic issues, as was mentioned already before in terms of, for example, lack of targets and so on. And also from our point of view of analysts, what we notice is that it does not provide an assessment of the benefits of acting at the European Union level. And therefore, there is no assessment of the current cost of inactions that we are paying. What we try to convey in our brief study is that the cost of inaction is huge and increasing. So the assessment of the current cost means the potential benefit of action is composed at least by 3 dimensions. The realization of women potential in the labor market, the promotion of an attractive sector with creation of good employment in the care sector, and the potential for the development and independence of the people who are cared of. So we're speaking especially of children, the elderly, and disabled people. All these areas, action in these areas, have a primary positive social impact, but also could bring economic gains. One of our outcomes is therefore that the fulfillment of fundamental rights and social rights are both aims in themselves and can bring economic benefits. And this is what we call sustainable growth, why we gave these titles. So not economic benefits at the expenses of social rights. In our chapter, we give a sense of this economic case using what we call back of the envelope calculations, but that give the sense of the magnitude of the current cost of inaction. Well, first of all, we discussed before, 242 billion euros of care penalty. That means what we could gain through a better realization of women on the labor market. Secondly, the promotion of an attractive sector and creation of good employment. So the overall labor income generated by an increase in employment just to cover only 50% of the current needs in childcare and long-term care would be of about, according to our calculations, 68 billion per year. If on top of this, we assume improved working conditions, we get to more 96 billion per year, just calculating in improvement in wage levels. But this, of course, could be more comprehensive, including better prospects of career progression, training opportunities, and better working conditions overall. Lastly, the third element, the potential for the development of the people who are cared of their independence and their human capital due to increased quality of care services. This means increased human capital for children and quality of life and independence for the elderly. We try to estimate the positive spillovers of the cared of based on US estimated impact of preschool enrollment on GDP. And projecting this on EU data, we can estimate that halving the unmet needs for children between 0 and 3 years of age in the EU could lead to a positive impact on GDP between 25 and 64 billion per year. So another relevant amount, relevant economic indicator. So we investigate possible avenues for EU action for these 3 areas on both the supply and the demand sides of care, both paid and unpaid. And because of this vicious cycle structure that we try to depict, all the 3 areas must be tackled if we are to achieve a meaningful change. And the key actions are in areas such as rebalancing between men and women in unpaid care tasks within households, mobilizing resources to increase quantity, quality, and affordability of care, and improving working conditions in the sectors. That also means making the sector more attractive for workers. What we define as the trade union between action in these 3 areas is to address the systematic under-evaluation of care work. And these require investment, money invested, to depart from what we called at the beginning a low investment model. Care is a public good and needs public policies and interventions to guarantee accessibility, affordability, and quality. And we argue that the European Union budget could play a major role, which is not the case so far. It has been estimated that member states in their recovery plans dedicated only about 10% of total funds to a overall health, economic, and institutional resilience, which may include investment in the care sector. So this is an upper bound estimate of what might have gone to the care sector, and which is surprisingly small despite the salience of the issue following the pandemic. It is also useful to remind that the European Union, with respect to member states, has a reduced cost of borrowing. For example, during the pandemic, the short-time work scheme mechanism, the SURE mechanism, allowed to member states to save about 8 billion euros just thanks on interest rates savings. Last but not least, we know that public expenditure on care has a high multiplier. An example from a study on Austria tells us that every euro spent on long-term care gives 1.7 euros of GDP. So spending in care is an investment that more than repays itself. To conclude, I hope I've not been too long. So our contribution points at a huge potential benefit for European Union action in the care sector, which corresponds to a huge cost that we are currently paying for not acting. But this potential benefit is both social and economic, but to reap its investment is needed. This is to summarize our core message. Thanks.
Cecilia Navarra, thanks a lot for this contribution, and I would like to invite all those that want to know even more about the important points that you made to go to the chapter that you wrote with your colleague Mina Fernandez in the policy study by FEPS and FES. The policy study is called the European Care Strategy, a chance to ensure inclusive care for all. And your chapter is care as a driver for sustainable growth. So actually the big thank is for having stressed that addressing care deficit is not only something that we have to do out of our moral compass, but it is something that is can be the building block of a real sustainable strategy for economic prosperity, and there are a lot of returns. So it's a productive investment in a sense. And allow me to also use one number, because you refer to this big number of 240 billion per year. That is somehow the loss or what the gain that we could have in case the decision on unpaid care would be equally impacting men and women. Of course, it's at the aggregate level. It's a simulation, but the number, if we disaggregate per week, we speak about 340 euro per week per woman. It's a lot. It's a lot. This gap, and it makes sense to fight to avoid this income and earning gaps. So big thanks to the two of you. Let me pass to Milan Berglez for a comment and your input, even politically, on this. What made you happy about the work done at the European Union level, but also where you want to go in the different dimension of unpaid care, child care, long-term care. If I'm not wrong, you have also recently been appointed chair of the European Parliament intergroup on children's rights. So you will be one of the advocates and fighters for childcare in the near future. We are happy to listen from your inputs.
Yes, thank you very much. And firstly, allow me to thank you for organizing this important event and webinar, and with this keeping the care on the European agenda. And particularly for framing care within the multi-layered, but also person-centered concept of well-being. This is the starting point. Regarding the report and the strategy itself, the European care strategy is just first step, I would say. It is important to make it, but it is the first step of significant change, bringing the care at the center of our policies, societies, and economies. And the biggest change actually happened with the change of narrative, not something more. We are still in the change of narrative. We are more or less speaking the same language. Commission, Parliament, also I would say civil society groups, also carers and their unions. And this was possible because of pandemic, and this is my political assessment. Without the pandemic, everything will be put it under the carpet within the particular societies, as it was so far, because of many reasons, and particularly because of duality of health on one side and social policy on the other. And of course, we have, with the pandemic, we realized our deficiencies of care systems in particular member states, and of course, our reliance on family and informal carers, above all women and their unpaid work. So this is as I would say, the starting point. Now, European Parliament would like to have more that what's done actually, particularly in the long-term care, while compared to the indicators there in the strategy regarding the child guarantee, things are, measurable, but a lot of things can be improved also in terms of national action plans, of really doing things with the most vulnerable groups of children, in addition to what has been done so far with child guarantee. But what is the important is that we are facing here a lot of challenges, and we have to focus and deal with care in the holistic way, because the partial approaches will just deepen the existing gender and other social inequalities, aggravating the care drain, which is existing within Europe and also outside it, and cross-country differences in the access to services and quality of life at all ages. So we will need also European investment, not just European strategy. We have to put money where our aims are. So there is a lot of work actually to be done, and most of member states are unable to do that. Because of that, we are speaking about the need for European care deal, including common, let's say, common standards on one side, and including also, of course, European investment. And this is particularly important in terms of demographic context, with the aging of the population, with older persons. I'm preferring this expression to elderly, because this is a sign of ageism, probably. But okay, we are used to, so we have to, to do more, also to do more in integrating men into the sector. This is one of the priorities which I see as very, very important. So with this gender imbalance, with this gender discrimination, we see also that the quality and accessibility of quality service is much lower. So we need to tackle this issue. With that, we will be really we will really have the problem. Now, as such, even those conclusions of the Council, or those which has been adopted, in addition to the strategy, are important political commitments of the Commission and Member States to prioritize care, and, as I said, in holistic and life course and person-centered approach. And what is important also with our report, that both in the strategy and in the report, we have the foundation for recognizing the care as a right on one side and public good on the other side. These two we actually need, of course, acknowledging the importance of investment into care and making use of its economic potential, including the opportunity for creation of quality jobs. We can speak about transformative economy, but only if there are investment. Without additional investment, there is actually nothing. Now, there are no tangible indicators in terms of long-term care, I would say, and also with dealing with persons with disabilities in terms of independent living. While there are much more emphasis, much more concrete indicators in terms of child guarantee. I have nothing to object in that case, but we can emulate some of those things, including having the coordinators also for long-term care, not just for child guarantee, and empowering them, because this is the particular issue which is very specific. Now, because this lack of finance, as I said, I would even propose something like, let's say in terms care guarantee, temporarily issued to make more affordable also by, of course, European investment and member states, like in child guarantee, but something like that also can be used as the example how those things can work at the European level. But also here I see the need for something like that. And as I said before, the care definitely have to be part of the next mandate of the Commission on one side, and on the other side also part of the campaigning for the next European parliamentary election. Because without serving and showing that, and here is our social democratic take also, I would say, without having us there pushing for this agenda, integrating, let's say, progressives and taking the issue from more conservative side, because most of demography, at least politically, has been much more associated with right part of our parliament and not really with the left, which sometimes they are looking how to use what we have already achieved also in the sector of care.
Thanks a lot, Mr. Berglez, for your clear statement, and also for keeping the ambitions high to go beyond a care strategy and reach a care deal and a care guarantee for Europe. For and this, also showcasing that in view of the upcoming elections, someone really wants a caring Europe. That is actually what we are trying to advocate for, actually, and convince people that we need to move in that direction. I would like to thank also the participants that are starting to file questions on Zoom and on YouTube. This is the moment also in which I'm happy to give the floor to Mary Collins from the European Women's Lobby. She's at the moment acting Secretary General of the organization, and I'm sure she has a lot to say about the European way to achieve a meaningful care strategy. Mary Collins, you have the floor.
Thank you so much, and good afternoon, probably at this stage, to everybody. I'm very happy to be here, and I'm really happy that we're talking about care, because it's actually quite extraordinary that throughout all of our lives, from the very beginning of humanity, care is an absolute essential role. I mean, it's something that's so central to our breathing and living and working and playing and whatever we do. And yet we're looking at it, you have all the arguments. I've listened to the outcome of your presentations, and we have all the arguments. We have the demographic, we have the economic, we have the benefits, we have who would gain. There are all of those arguments are there. So I suppose the question now is, why is it blocking, and why can we not move to a different level? And for us, the European care strategy is certainly a first step in the right direction. That is definitely, we believe it does have the potential to bring us further. And it's the first time as well, thanks to the pandemic, because the pandemic showed very clearly that we are all actually dependent not only on care, but who the carers, and the majority of carers are women. So it really brought to the forefront the fact that we take women for granted, and we've taken them for granted all of our lives throughout history, basically. And it's time now to change that. So we believe that the care strategy has that potential to bring about a change in the way a mindset change in the way we think about care. Actually, the way we think about it, to actually even think about it. Because as I say, it was taken for granted for far, far, far too long. And everything is shaped around the male life cycle in terms of rights, in terms of pensions, in terms of everything else. And women are sanctioned because they step out of the labor market, because they're not like men, basically, and their life course is not like men in terms of their investment in the labor market. But they're sanctioned at the end of their lives. And what we can see is very high levels of poverty among women as they age, and particularly women over the age of 65, who are in pension age, very, very high levels. So we haven't taken care of our carers either. So we believe at the European Women's Lobby that we need a totally different way of approaching this and a different model. And I'm very happy to hear that the term, the care deal for Europe, was used, because that's exactly what we're calling for. We want a care deal for Europe. So a care deal for Europe means holistic, and I've heard many of these issues as well. So there's obviously, we agree with some of the bases. Holistic life cycle approach, and an approach that actually challenges the male breadwinner model. So we want to move towards an equal earner, equal care model, excuse me, which means that both women and men throughout their lives can step in and out of the labor market without being sanctioned, and that they actually have the right to do that, and at any stage. So we're talking about different care needs at different stages of life. Obviously, the care strategy focuses on the two poles, children, long-term care, but we believe that care is a necessity throughout life. We can have care for ourselves, care for our neighbors, so that we have that possibility to actually move in and out, step in and out, of the labour market without being sanctioned. Because at the end of the day, that's what we very, very clearly see. And with an ageing population as well, you know, the fact that women are poorer as they age, we're going to have a very, very high levels of feminization of poverty, and we can see it now, in a couple of years' time as well. So I think in the demographic perspective as well, we must take that into account. So really the care deal would give the opportunity to challenge our dominant neoliberal economic model as well, because we really need to work towards what we would call a feminist economic model. And feminist economic model places care at the very core of the actual model itself. I heard the word investment being mentioned many times by you, and absolutely. So we envisage a care deal that would be on the level playing field as the Green Deal, and if you like, we could call it the digital deal, the digital agenda. It is the missing piece. It really needs to have a standalone pillar, for which there would be investments like the Green Deal, the percentage that has to be reinvested in green policies, and the digital deal as well. And we think that as well, the care deal would need at least 20% of the investments coming from the different sources, and particularly the recovery mechanisms, the Next Generation EU. The Next Generation EU as well is a long-term investment. So it's up until 2050 even. So it really is about investing in this generation, because it is this generation that will actually be managing the EU Next Generation finances and funding and everything. So it really is now is the time. Because I think that we could reach potentially a stage in 50 years' time and say, what? We've invested all of this money in different areas, but we actually haven't invested in care in a systematic way. And I think it's going to be very hard to answer that question to future generations. You know, why did you leave us just the way you've always left us, just following and the main course of things. So I think that we really need very strong investments. And I think that in terms of the multi-annual financial framework, particularly the next one, we need to start preparing for that now. We need to start really putting in place policies and that will actually place a care deal on a level playing field with other kind of deals that will be that are there for the moment, but that will be coming forward as well. So that's really our main message, and I'm really happy to hear that. I do think we're all talking the same. We're actually we're not disagreeing. It's just the angles that we're focusing on. But I think this can be a real, life changer, and it can also have a massive impact on generations of today, but particularly future generations. So let's look beyond the horizon. And let's start really looking and investing in what really, really matters, because we saw in the pandemic, if women were not at the forefront, actually, our whole economic system would have collapsed. So we absolutely depend so much on care that we cannot take it for granted anymore. We have to value it. We have to make sure that it is a core investment in our society moving forward. And we need to make sure that everybody, that care, sometimes the word burden is used. We must stop using those terms. Let it be our collective responsibility towards each other. And that's what we need to really move forward with. And we hope that the care strategy is the start, but we need to go much, much further. And we hope that in the, when the revision of the multi-annual financial framework, that really we can start correcting those kind of things that we really forgot about, and really start putting in place mechanisms that will give care its right value in the world, because at the end of the day, we wouldn't be sitting around this form either.
Dear Mary.
So thank you very much. Thank you.
Thanks a lot, but please stay with us, because now is the moment in which I have the responsibility to pick some of the questions that the audience have flagged. And also we have a time constraint in this 1 hour session. We will probably take some additional few minutes. The only way I see to get it done is that I file some of the questions, maybe 3 or 4, and then I give 1 or 2 minutes to all of you to respond to the one that you feel like you can contribute. So stay with me for these few questions. The one that I will not pass to you, but I still want to single it out because it's a nice question by Philip. Actually, on the management of the demand, not the supply of care. I don't file it now because it will be actually the focus of the next Care for Care policy series meeting that will take place on the 10th of October and will focus on enhancing sustainable long-term care, in which we will also address somehow the issue of rehabilitation and how somehow the management of the demand. That is an important question that Philip put forward. But the other question that is, for instance, by Kurt, on the contradicting position of the EU. That on the one side, we stress that social services are welcome and valued. They are a valuable contribution to society and the economy. But on the other hand, we consider public expenses for childcare and long-term care as a financial risk, as a burden for sustainability and a cost from a public sector point of view. So how can we reconcile? How can we win the fight? From a conceptual viewpoint, that it is really an investment. Other issue put forward by Marika, specific on the Council recommendation on early childhood education and care. Mostly the Commission has moved, also thanks to the work done on the European Child Guarantee, to focus on the improving access for childcare and the affordability. Sometimes the Commission even mentioned free child care. But we know that the gap from member states, some of them, it's really difficult. So what is the way that the European Union can better accompany? We mentioned that for long-term care, targets and timeline is missing. Instead, to make sure that the implementation and the targets are achieved in terms of childcare, what do you think is needed from the EU? What could the EU do to foster the implementation of the ECEC angle? And then we have Ekaterina pointing out the issue, I would call it, of regional imbalances, so that somehow the European care strategy is of course also a way to address cross-country gaps in care, but at the same time within countries. So how the European Union can better address the idea that the care gaps somehow shrink in a single country, maybe before the difference between urban and rural areas, or different between regions, and become more homogeneous and more quality within countries in equality. And the last on quality, again by Kurt, is he stresses that the problem sometimes is not that of creating a care service only, but the issue is keeping it alive and keeping it operating over time with quality. And that is an issue because sometimes the European financing, it's good in setting up the infrastructure, but maybe not in covering some of the cost that pertains to quality and workers over time. So we had different questions for you on if you want the regional or within country inequality, contradiction in the theoretical framework that the European Union is using, quality, and implementation of the ECEC recommendation. So 4 important angles in which I'm sure you can comment. Perhaps we can start again with Professor Saraceno a couple of minutes maximum. So don't feel obliged to respond to everything, just a couple of things that you think are very constructive.
Okay, I hope is my audio out?
Yes,
no?
perfect.
Okay. Yes, I will just take two. How to support the implementation of the childcare strategy, particularly with regard to the accessibility. In addition to, I think that what Mr. Breglitz said, that is to say that is a right, and that is, I mean, to stress the right dimension to care, both for children and for the elderly, is the way to go. That is, if it is a right, like the right to schooling, then also the right to early childcare and education should be made accessible also financially. By the way, this would also probably support the use of early childcare in those countries or regions or social groups where early childcare is still perceived in an ambivalent way because it's thought that it's better that the mother or that the family takes care. If it becomes a right, like the school right, and that is the right of the child, is not only a right of the mother who works, but is a right of the child. Then, and so this is a way, I think. And the second issue is the intra-country regional, how the EU can help or incentive countries to address intra-country inequalities in the provision of services. I think that that should become a standard request in all ways, in all the instances when there is a EU financing, but also in the evaluation of the plans of the countries. For instance, in Italy, in the resilience and recovery plan, it was clear, I don't remember if it was a request by the Commission, but I think it was, that there was an issue, it was compulsory to redress the North-South inequalities. That is, let's say, for instance, 40% of all resources should go in all fields to the South, because it has fewer not only care services, but also other things. But then, of course, you have to, the EU must also be monitor this closely, because, for instance, in my country, which is Italy, a very important issue we are discussing here, that is early childcare, but also long-term care, are about among the targets which has been postponed. So they are no longer a priority. They say, okay, we will do it, but we are not ready to do it. So I think that there should be a power by the Commission, particularly in this case, since it is providing part of a lot of the finances, to stress that this is not feasible, or I mean to control or to make sure that this is not just a dismissal of this priority.
Thanks a lot, Professor Saraceno. Up to you, Cecilia and Mina.
Thanks a lot. I take up maybe 1 or 1.5 questions, and then I leave the floor to Mina so that we both contribute to the discussion. As regards, I wanted to take up some points on the contradiction between different, let's say, rules that we have at the European Union level. Well, that's probably one of the areas that tell us that some rules could change and should change. And especially so for example, speaking of care, we tried to make the point that care is first of all an investment, then a cost, so that spending in care is an expenditure that more than repay itself. And this probably should be reflected, for example, in the European semester. So how the EU economies are evaluated should probably change and incorporate the fact that meeting care targets is central and not accessory, not ancillary and doesn't come after other like public finance parameters. And the EU budget could play a role. So the EU could contribute to that spending. And we mentioned the example of the EU possibility to borrow and the lower cost of borrowing for the European Union than for the member states as an example of the savings that could be done when the EU budget is directly involved. So these are a couple of reflections on this. And on just a small reflection, what concerns regional imbalances, yes, one of the elements of the rationale of EU action is also the mobile intra-EU workforce. So we are speaking of which calls the European Union into calls for action of the European Union, but also within member states' regional imbalances and quality. I think that both call for constitute, so the need for a spread accessibility and high quality of the services constitute the dimension of care as a public good that needs public actions to guarantee a right. Just this point, and I leave the rest to Mina if you are okay to jump in.
Very valuable point, Cecilia. Mina, you have the floor.
Thanks, David. Now I'll pick up the question about the issue of setting up services and keeping them operating over time. What's central here has been mentioned several times is the institutionalization of care, whether there's a care deal for Europe or but there needs to be a concrete, definite action. And this can lead to an institutionalization, which can ensure that the services are set up and taken care of. What's also important is not just the infrastructure, but the workers, which several of the speakers has mentioned already today. And here we need to have better recognition of care work as a profession. And this also means relevant training, certification, career progression, and also training in relevant IT skills, for example, and training that can continue over the working life of the workers. Thank you.
Thank you, Mina. We continue with Milan and then Mary.
Thank you. Yeah, I would also try to pick some. First of all, regarding the contradiction. On one side, valuation, on the other side, taking expenses, into care or taking investment to care as an expenses which we cannot afford because of other crises. Here, in addition to what was said, I would also reframe, or sometimes I'm on the side of those within also our family who are like to speak about going beyond growth, going beyond GDP. All those things have to be, politically implemented. Otherwise, it is impossible to do those things. So this is one of the issue where things are very, very important. And of course, European semester provides possibility to do something in respect of that. I would even say that in respect of recovery and resilience facility, we has been unable, even at the parliamentary level, to put on equal footing also social criteria in addition to green and digital. So we have to fight, we have to get majority, otherwise there will be no push for this part of social. And I think framing it within the framework of care, it is probably the most easier to influence, to convince people why this is so important. Regarding the quality or creating just services and quality, I would say, yeah, we need some common minimum definitions, and we need something like common framework directive on all aspects of care, family, informal, formal. While I'm speaking about formal, I'm always thinking about institutionalized, because sometimes there is also a gap, which is going about, contra to what, at least in some member states, of what is, the expert view, what should be the future of care. And this is the approach coming from formal, this means institutionalized, towards family and, of course, community based care. So we need to do that. And I know that there are some member states where just institutional is well developed, including mine, and we are still in form of making, this homemade and community-based care the possibility and right to older persons. And with that, a lot of things also change in terms of institutionalization and what kind of services are there, and also because there will be always a need also for that. And of course, the difference between informal and formal, and on the other side, family carers is also very important. While I would say that for getting better paid and better respected informal carers in particular, but also family carers, we will need public services. We will need public service as a support for them, at least that as a starting point to going into the better valuation of care as such within the economy. Because at the end of the day, what we are evaluating or what we are not valuing, this is very much dependent also on political choices, I would say. So we have to stand for that.
Instead, unfortunately, sometimes we observe commodification and privatization of these services that is endangering quality and dignity of caregivers and care recipients, and sometimes also over time might even increase the care needs. So that's a worry. Mary Collins, your turn.
Thank you very much. Yes, I agree with a lot of what the previous speakers said, and I think the right to care and be cared for at different stages of our lives is part of our shared humanity, and we need to really establish it as a core right. And that is number one, I think, because other things will flow from that over time and that. But I just wanted to come back to the question maybe on the contradictions between social services that are valued and when we talk particularly about childcare, that it's, seen to be an investment, it's too expensive, we can't do it. I think there are also lots of other contradictions in terms of processes, for example. So if we look at, for example, the European Pillar of Social Rights. So Principle 19 is the right to services. But when you look at what are we talking about? We're talking about big infrastructures. So we need to also be able to define that within that kind of a principle, that childcare, long-term care, all forms of care is actually part of those services as well. So there has to be investments. Now, I know the European Pillar of Social Rights is not binding, but it certainly is a guiding force in terms of where investments can go. So I think we need to challenge that because there can be contradictions. It can also be contradictions, through the European semester process, the economic governance process, where member states are given recommendations to, for example, reform their pension systems or things like that, but are completely contradictory then with investment in caring and in other public services as well. So we need to have, we would like to see mechanisms like gender budgeting being brought into all of the different processes, because it means that you will actually be looking at your public finances in terms of a gender lens as well, and in terms of who benefits and what are the gaps, how do we need to ensure that it is inclusive, because at the end of the day, it's the sustainability will depend on having more long-term mechanisms where we can actually check at the beginning to check who's going to benefit, to have an assessment process in place, so that we can also ensure that the sustainability it goes beyond the time span of particular program or whatever. But because at the end of the day, it is that sustainability, and it's the also to challenge that infrastructure is seen because maybe it's tangible, you can actually see it, it leaves a trace, but the long-term investment in care is actually going to reap massive benefits later on in life, now and later on in life. So I think we need to also look at the processes and see do they contradict each other, which we think they do, and therefore we need to have a very coherent approach. And for us, gender budgeting is one of the mechanisms that we think, at the end of the day, would certainly make sure that we're investing in the right places and for the right people, because it's all about human dignity. And also, if I may just say, in terms of sustainability, so important to have the input of the users of care to shape. We talked about having common framework, but also we need to make sure there's a participatory, that we're listening, we're hearing what do we need and what do we want, what should we be valuing and putting in place. So really important to have the input of the users, because at the end of the day, it is about dignity as well for all. Thank you.
Thank you, actually, dear Mary, and it's should be the moment of conclusions, but we are already over time. So instead of conclusions, what I will do is a moment to regroup and to stress the different materials that are available on the topic. You have been listening today to the presentations by Chiara Saraceno, her chapter on demographic challenges for social cohesion, and Cecilia and Mina, her chapter on care as a driver for sustainable growth. That are both part of the policy study, the European Care Strategy, a chance to ensure inclusive care for all. The talk today, as I mentioned, is part of a series of Care for Care policy online meeting. The next one will take place on the 10th of October, enhancing sustainable long-term care. But other two already took place, and you can still find them online on FEP's YouTube channel. One was dedicated to fair working conditions in childcare, with a great contribution of EPSU. And the other one instead was looking at somehow the future of care, and the impact that digitalization and the online platform can have in the delivery and in the changing needs around the issue of care. So it's a package of 4 meetings that you will find online. But FEPS, the Foundation for European Progressive Studies, and the Friedrich Ebert Stiftung office in Brussels, they are actually active since probably 2019 on the issue of care under the lemma Care for Care. So go on FEP's website, look for Care for Care, and you find a lot of material. For instance, contributions on a series of policy study, including Professor Javati Ghosh, speaking about care workers. And importantly, let me single out 2 contributions. One by my colleague Laetitia Thyssen, that is actually looking at the care-led recovery, so at the care-related measures within the national recovery plans as part of the Next Generation EU, assessing 8 different recovery plans from different countries from a care perspective, a kind of a unique and extremely valuable contribution. And the other one would be instead a policy study on delivering the European Child Guarantee, with 4 top experts on the child policy: Margarita Leon, Christian Moravito, Emanuele Pavolini, and Michael van der Broek, assessing 4 national plans on the child guarantee. Little spoiler, even the top performing, that sometimes, for instance, Finland, not everything is that perfect as it might seem. Lot of material, and FEPS and FES will remain active on the topic. I would like to thank you. I started by naming you with your surname, but I will conclude at the end of the session. Now we are all friends and part of a single fight for a caring Europe. I will use your first name. So thanks a lot, Chiara. Thanks a lot, Cecilia. Thanks a lot, Mina. Thanks a lot, Milan. And thanks a lot, Mary, for this session. And a big thank also to my colleague at FEPS, Laetitia and Olean, and at the Friedrich Ebert Stiftung, Agnes Masch, for the big support and organization of all this. Let's connect on 10th of October.